Welcome to the University of Michigan Dentistry podcast series, promoting oral health care worldwide.
The first method of isolation to be demonstrated to you is the Erickson Vac-Ejector. The primary reason for the Erickson being developed was for both the comfort of the patient and the operator while using ultra-high speed in the washed field technique. The Erickson Evacuator enables the operator to maintain maximum seeability in difficult areas of access and to work by himself without using a chairside dental assistant. In the Erickson Evacuator kit, there are two hoses, one large and one small, used for evacuation, 5 various size bite blocks, 3 upper universal shields, 2 lower right and lower left shields, and 2 ejector pipes, one special type and one regular type. Now I'd like to assemble the Erickson Evacuator for you. When assembling the Erickson Evacuator, it's important to have a container of water to make the assembling easier for the operator. The large evacuator hose is connected to the ejector pipe and to the high velocity evacuation on your dental unit. The small hose is used for vestibule evacuation, for maximum evacuation if you're having a problem with lingual access. The 2 ejector pipes that were described to you are the special pipe and the straight regular pipe. You can notice the difference in the stems of the pipe. One pipe is contoured and the other is straight. The contoured pipe will be used for patients that have a narrow arch and for pedodontic patients. On the bite block, it's extremely important for you to understand when placing this on the Erickson Evacuator pipe that when your patient has a small, narrow arch, that you use the small side of the bite block placed next to the ejector pipe. If the patient has a large arch, then you use the L on the bite block for the large side. Now I'd like to place this on the Erickson Evacuator. If you wet the bite block in water, it's going to be much easier to place the bite block on the ejector pipe. I'm placing the large side, or the L side of the bite block, on the ejector pipe arm, and I'm going to place it until it's snug against the ejector stem. This will make it much easier for me to place the ejector in the patient's mouth. To assemble the upper universal shield, I'm going to wet the shield and place the shield on the ejector stem. When you place the shield on the ejector stem, push the shield all the way down until the shield and the bite block are touching. And then you have the Erickson prepared to place in the patient's mouth for the upper arch, either quadrant. When you place the bite block in the patient's mouth, make sure that you place the bite block first and then the shield. The bite block should be placed on the first molar in an adult patient and on the first primary molar of a child patient. Ask the patient to open as large as they can Place the bite block first and then the shield, and make sure that you compress the sides into the vestibule and around the retromolar pad or the tuberosity. Now you're getting maximum evacuation from the vestibule and from the ejector pipe, and then this is where your evacuator hose is attached. And then the other end of the evacuator hose is placed in the high velocity evacuation. And you're prepared to work. You have maximum seeability in the oral cavity for an area with difficult access or for working alone. Now I'd like to demonstrate the other two items used for isolation. The suedapter saliva ejector is also used for isolation when taking a rubber base impression or for difficult access when you're having a problem with the patient's tongue. The Erickson Evac-Ejector is placed in the oral cavity on the lingual side between the tongue and the arch. The rubber tip that you see on the tip end of the suedapter is called a softy rubber tip. This tip has holes in it and it's placed over the wire tip that has the evacuation area. There is a slit in the suedapter, and this is the area where the evacuation takes place. This particular item is attached to the saliva ejector outlet. There are 3 blades used with the suedapter: a large blade, a medium-sized blade, and a small blade. The small blade is used on a pedodontic patient, and the large blade is used on a patient with a very large arch. When placing this blade in the suedapter, the area where the slit that I talked about before is the area where you place the blade. By attaching the arm that I'm pointing to right now into the slit and pressing forward on the spring, the blade will slip into the slot. You are now prepared to place the suedapter in the patient's mouth. The softy tip is used to cushion the suedapter in the vestibule. When placing the suedapter in the patient's mouth, make sure that you ask the patient to place their tongue toward the roof of their mouth. This will enable you to place the suedapter more easily. The attachment is called the chin attachment and is placed underneath the patient's chin, and then you secure the screw. When using the softy tip on the suedapter, this enables you to use high velocity evacuation and the maximum evacuation on the saliva ejector outlet without impinging on the tissue. The next item that I'd like to go to are the cotton roll holders. With the cotton roll holders, you have a pair, a right holder and a left holder. The curved wire on the cotton roll holder indicates which side goes over the lip. So when you're using the cotton roll holder, the side that has the lip on the lower left will go over the lip, and the chin attachment comes up underneath the patient's chin to secure the cotton roll holder. It's important to remember to ask the patient to place their tongue toward the roof of their mouth when inserting the cotton roll holder. This particular item is not attached to a high velocity evacuation system. This item is used alone when used in the oral cavity. Now I'd like to go to the clinic situation and demonstrate all three items of isolation. In the normal clinic situation, the patient would be in the supine position for using the Erickson Vac-Ejector in the upper right or upper left quadrants. The first Erickson Vac-Ejector I'd like to demonstrate is the upper universal. This particular Erickson can be used on either side of the upper arch. The first one I'm going to show to you is the upper right. If you're working with a chairside dental assistant, she can have this prepared for you prior to working on the patient if she knows what area of the mouth you're going to be working in. When positioning the Erickson, place the bite block first, ask the patient to close slowly, and then position the Evac-Ejector shield. When positioning the shield, make sure that the posterior portion of the shield is placed around the tuberosity, and then you are able to begin working. You'll notice that the upper right quadrant is isolated for maximum seeability into the oral cavity. The evacuator hose has been attached previously by the dental assistant and then is attached to the high velocity outlet. When using the Erickson Vac-Ejector, be careful not to use maximum high velocity evacuation. Use a medium amount of evacuation so that you're not impinging on the tissue in any area of the oral cavity. Now I'd like to demonstrate the Erickson used on the upper left. The reason the shield is called a universal is that they may be used on either side. Close slowly, please. After the patient bites down on the bite block, place the shield around the tuberosity and make sure that the patient is comfortable. Open. Now I'm going to demonstrate to you the lower right quadrant. Now the shield is shaped completely differently, as you saw before when we were using the typodont. The evacuation holes are placed toward the lingual or the vestibule. You position the bite block first. You can help. Ask the patient to close slowly, and then place the Erickson along the vestibule in the patient's mouth. It's important to remember when you're using the Erickson Vac-Ejector in the lower right or the lower left quadrant, again, to use the minimum or medium amount of evacuation, but not the maximum amount of high velocity evacuation. Make sure that you ask the patient if the patient is comfortable after you have positioned the Erickson. Now I'd like to demonstrate the lower left quadrant. Position the bite block first, and then the shield, and ask the patient to slowly close. And then the dental assistant will position the shield along the vestibule. The evacuator holes are running along the lingual portion of the lower arch, and the area is isolated for maximum seeability in the lower left quadrant, and you're prepared to work. Open. The next item that I'd like to demonstrate is the suedapter. I'm going to use the large shield because I'm working with an adult patient and we're working in the lower left quadrant. When you position the suedapter, make sure that you ask the patient to position their tongue toward the roof of their mouth and then place the blade into the vestibule. Now you can relax your tongue. Position the chin piece tightly against the patient's chin, and then secure the screw on the chin piece. The dental assistant has previously attached the saliva ejector outlet to the suedapter, and we're going to use maximum evacuation because I have a soft D-tip placed on the suedapter. Now the area is isolated and we're prepared to work. Make sure that you ask the patient if the patient is comfortable. And we're prepared to work in the lower left employing this suedapter. Now I'm going to show you the cotton roll holder used on the lower left quadrant. Remember I said that the cotton roll holder was the one isolation item that I'm demonstrating that does not hook up to the evacuation system. It's used by itself. Remember again to ask the patient to place their tongue toward the roof of their mouth. Now you can relax your tongue and position the chin piece into place, making sure that the lip is comfortable and it's underneath the curved metal of the cotton roll holder. Now this particular item would be used when you're using a fluoride treatment on an adult or a pedodontic patient. I want to demonstrate the clinical application of the theta triangle. The L and the S shown on each triangle means large and small. The point on each triangle that shows the S and the L is the point that you place most posterior in the oral cavity between the retromolar pad and the tuberosity. The theta triangle are pressed cotton fibers used for isolation during cavity preparation, during cementation of crowns, inlays, and bridges, and other methods of isolation in operative dentistry. Now I'd like to demonstrate the application of the theta triangle. The pressed cotton fibers are flexible and are contoured and should be worked with before it's placed in the oral cavity. When you're placing the theta triangle in the oral cavity, place that tip where the L is shown on the theta triangle posterior in the oral cavity between the tuberosity and the retromolar pad. Like any other cotton fibers that are placed in the oral cavity, before removal they should be wetted completely so that you're not hurting the tissue in the patient's mouth. This can be done by the dental assistant. The theta triangle can also be used to isolate the tongue in the patient's mouth. You can take the theta triangle and place it in the vestibule between the tongue and the quadrant of teeth. The operator can then place his mirror on top of the theta triangle. Now I'd like to demonstrate the application of the cotton roll. This particular item is used, probably most frequently used in operative dentistry for isolation during an operative procedure. You place the cotton roll between the cheek and the quadrant of teeth in the vestibule. Again, like the theta triangle, this item should be wetted before it's removed from the patient's mouth. It can be used on the buccal or the lingual portion of the oral cavity, in the upper or lower arch. That's all. Now I'm going to demonstrate the Erickson Evacuator, the suedapter, and the cotton roll holders on a pedodontic patient using the lower left quadrant. The same methods and the same items apply for a child patient as they do for an adult. So I'm going to demonstrate only in the lower left quadrant. The only item that has changed, as I mentioned before, is the contoured ejector pipe. When you're working on a pedodontic patient, use and employ the contoured ejector pipe because the patient has a smaller mouth. I use the regular pipe on the adult. When you're positioning the Erickson, it's the same method as we used for the adult. Position the bite block and ask the patient to slowly close. Now remain biting, remain biting. And the dental assistant positioned the shield around the vestibule in the patient's mouth and around the retromolar pad. The area is isolated and the operator is prepared to work. Open. Now I'm going to demonstrate the suedapter And there's only one item on this suedapter that I changed, and that was employing the small shield because I'm working in a much smaller area. If I use the large shield, the patient would be extremely uncomfortable. Open. Ask the patient to put their tongue toward the roof of their mouth. Now you can put your tongue back. And you attach the chin piece around the chin. Close, please. And then secure the screw the same way you did with the patient. Open. And the area is isolated, and you are prepared to work. Open. Make sure when you're working with the patient, whether it's an adult or a child patient, that you ask the patient if they are comfortable when employing any of these methods of isolation. Now the cotton wool holder. Open, please. Ask the patient to position their tongue toward the roof of their mouth. Dental assistant can place the cotton roll along the buccal portion. Now position your tongue back in. Close slowly. And position the chin piece around the patient's chin and make sure that the lip is comfortable under the curved portion of the cotton roll holder. Now the quadrant is isolated and the operator is prepared to work. All of these methods of isolation may be employed in the clinic situation with an adult patient or with a pedodontic patient. The three items that I showed you were the Erickson Vac-Ejector, the suedapter, and the cotton roll holders.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.